Hello and welcome to today's webinar, Trauma-Informed Organizations, a learning collaborative and opportunity to engage with the National Healthcare for the Homeless Council. This webinar is presented with support from the Health Resources and Services Administration and the Bureau of Primary Health Care. Before we get started, we have a few quick logistical items. So for your questions and technical issues, there is a chat box you'll see at the bottom right of your screen below the presentation slides. You can submit at any point during the presentation, during the webinar, if you have any technical issues or questions. Also, if you have any technical issues, you can call our office at 615-226-2292 and ask to speak with Michael. This session is being recorded, and the PowerPoint presentation along with the recording will be posted on our website. It's www.nhchc.org, and that'll be posted within 3 business days. So with that, I'll go ahead and get us started. So my name is Juli Hishida, and I am a project manager on the research team at the National Healthcare for the Homeless Council. And I am joined with Katherine Cavanaugh. So Katherine, would you like to introduce yourself?
Yes, hello. I am Katherine Cavanaugh, the consumer advocate with the National Healthcare for the Homeless Council, and I am based out of Baltimore.
Great, and we are co-leading the Trauma-Informed Organizations project for the Council. Katherine and I are very excited to share this upcoming opportunity with you. And because we expect a lot of interest in this project, and since it'll span over the next 2.5 years, we thought it might be helpful to have this informational call. Also, for this project, since there's a lot of background information and we're now accepting applications for the Learning Collaborative, we thought it'd be a good opportunity for those who were interested to get some of their questions answered. And so you may have already had a chance to read through the background document and the application, which are also available to download on your screen right now. If you click under Files, you just click on that title and then hit Download. That will open up for you. Also, under the web links pod, if you click on it and it'll highlight blue, then you can click the button that says Browse To, and it'll open that link for you. But we'll point to those documents in a few moments. So the purpose of our brief presentation today is really to provide a foundation for the project, for those health centers out there or other programs serving people experiencing homelessness that may be interested in joining throughout the next few years. And today I will outline the larger 3-year project. So that includes, our purpose, the vision, our goals and objectives, and then the more long-term timeline. And then I'll pass it to Katherine to go more in depth in talking about the plans for the current year that we're in, so year 1 of our project. We'll actually pause after Katherine to take questions before we move into describing the application process. And that's when I'll kind of go over more the criteria for participation, the expectations, and then how your health center can apply to participate. And then again, at that point, we'll open it up for Q&A again. So that's the agenda for this session. We can jump right in to the purpose. So why? Why are we doing this project and attempting to address trauma on an organizational level? And we have a 3-paragraph purpose statement describing the importance of addressing trauma in our work as healthcare for the homeless programs and community health centers. But you can read that statement if you download that background and application document. So to summarize, the purpose of our larger 3-year project is to support health centers so that they can align their larger organizational mission with principles of a trauma-informed framework so that health centers can work toward better treatment of existing trauma symptoms while addressing the causes of trauma and preventing further interpersonal and institutional trauma. And so how are we going to achieve our goal and purpose? Our vision is to do this through a learning collaborative model. And that's a method of engaging the participants to learn from each other and share their experiences, as well as having that didactic learning. And that may involve having invited subject matter experts present during one of our meeting sessions. But more specifically, the Learning Collaborative will have 3 components, which these components and the way that we're putting together this Learning Collaborative, it aligns with the Learning Collaborative model developed and promoted by the National Child Traumatic Stress Network. And these components, Katherine will go into a little more detail about in a moment, but they're the learning sessions, we'll have action periods, and then the one-on-one check-ins. So each year, the objectives and goals for the Learning Collaborative will change. They will be different from year to year. But overall, for the 3 years, when we think about what is it that we're going to achieve by the end of the 3 years, first, we're working toward creating a common understanding in how to foster a trauma-informed health center. We'll also be focused on developing a plan for health centers and other programs serving people experiencing homelessness, a plan to assess, to implement, and evaluate trauma-informed practices. And then more specifically, we'll be developing an assessment tool to evaluate trauma-informed organizational practices. We will be providing technical assistance so that, individualized support to health centers to help them, once they've completed the assessment, to help them implement the recommendations for changes and improvements on that organizational level so that they align better with the trauma-informed principles. And then lastly, we are aiming to support the health centers with ongoing evaluation so that they can measure the impact and outcomes of becoming a trauma-informed organization. And finally, for the 3 years, our objectives. So the objectives are really the who, when, where. It's really an extension of our goal statement. But with the who, it'll be Katherine and I as council staff. But we've also have signed letters of support from several collaborating agencies, including Fenway Health, School-Based Health Alliance, and 3 primary care associations, Mass League, Wisconsin Primary Care Association, and Michigan PCA. We're also working with subject matter experts from the field, and then of course you all who will apply and get accepted into the Learning Collaborative, you all as participants. And everyone has a unique role to play in the success of our project. But over the course of the 3 years, through the Learning Collaborative, we're aiming to develop resources. So for example, as I mentioned, the assessment tool. We're also developing a resource guide. But we also want to create this outlet for you all as colleagues and peers to share experiences, to share your insights about the change process in becoming a trauma-informed organization. And then lastly, we are hoping to develop a learning collaborative model as a training and technical assistance tool for implementing trauma-informed organizations in the future for other healthcare for the homeless programs, other health centers, and other programs, again, generally just serving people experiencing homelessness. So for the timeline for the 3 years, we are currently in year 1. So this began in July. And up until this point, Katherine and I have been planning, really working hard, putting together the materials for this project, having conversations with our partners. But for you all who may be interested in participating and applying for the Learning Collaborative, our first year cohort will start meeting in January. And we will have one web-based meeting per month for 6 months. And these will be considered our learning sessions. And in just a moment, Katherine will go over all the details for what to expect in year 1. But moving to year 2, that will begin July 2018. Again, we will have an application process. But for those health centers that participate in year 1, so this current year, they will have more likelihood of being accepted into the year 2 cohort. So we are definitely encouraging programs to join the project as early as possible. In year 2 is when we will invite a minimum of 5 health centers to use the Learning Collaborative to support those health centers in implementing the assessment tool that we will identify in the first year. And then lastly, in year 3, which is July 2019, and that'll wrap up in June 2020, the Learning Collaborative will function more as a work group. And they will use the findings from the first 2 years to develop the resource toolkit that I'd mentioned, and then also we'll be promoting all of our work at the 2020 conference. So at this point, I'll pass it on to Katherine.
Thank you, Julie. Yes, so I wanted to start off thanking Julie for that idea of what the 3-year project is. We thought it was really important to start off with that conversation so that everyone would have an idea of the overarching goals of this project and get greater context for what the intention of this project is in really considering what a trauma-informed health center is and how we assess it and implement the changes in order to make sure that our health centers are trauma-informed from our provider provisions up through the administrative level in our organizational policies. And it's something that we find really important. So we hope you're excited about this idea of the 3-year project. But as Julie mentioned also, we are focusing right now on just specifically the year 1 cohort. Everyone is invited to be a part of this either each year at a time, or ideally we would love to have people all 3 years. But so we really want to focus on what is going to happen during this first year, and just so folks know, that is what you would be applying for now. It's only asking for a commitment through the end of this June for folks who are looking to sign up with our year 1 cohort. And to reiterate, the goal of our year 1 group will be to really look at an assessment tool that will be helpful in evaluating what trauma-informed policies, practices, and procedures are throughout health center organizations, and developing an organizational plan for how do you assess and evaluate these different components, and then how do you implement the changes based on the recommendations. So really developing that assessment tool and the organizational plan to enact it. So in order to do this, the idea of year 1 is that we want to focus really on spending the next 6 months understanding the values and the goals of becoming a trauma-informed organization, looking at what are trauma-informed principles and models, and how those principles can translate into practices and policies and procedures, how you really ingrain these policies and these values throughout your organization. How do you develop an assessment tool to gather how well you are doing at implementing a top-to-bottom trauma-informed health center? And then how do you develop organizational structures that help you evaluate and implement the recommendations? That's really what we're hoping to get out of this first year. So in order to do that, as Julie mentioned, there's going to be 3 components of the structure for how the Learning Collaborative operates. One of those structures is going to be our learning sessions. So those are 90-minute sessions which will take place once a month. During those 90-minute sessions, we'll have subject matter experts who are presenting on what trauma-informed organizations are, what are some metrics that you can use to gauge trauma-informed organizations. We'll have some case studies from organizations who have already implemented trauma-informed assessments and conducted some evaluations and recommendations and hear their stories. And then we'll also hold some discussions as a group about what we see as the value and our reactions to the different tools that we're seeing and developing a structure for the organizational plan. In between each of those learning sessions, we'll have what we're calling action sessions, which is a much better word than framing it as homework, which I think people have a natural reaction to feeling homework. So during the action sessions, between our learning sessions, people will have about 2 to 3 hours of work to do to prepare for the next learning session. It'll either come in the form of viewing different webinars, different readings on articles, holding some conversations with your health center staff about some of the assessments or some of the policies, their reactions to it, and also reviewing some of the current assessment tools out there. During this Learning Collaborative, we have no desire to recreate the wheel. There are plenty of assessment tools out there for gauging whether an organization is trauma-informed. So a lot of our work in the middle of the year will be starting to review some of those assessment tools that are out there and seeing which ones we like, which ones make sense for health centers, see if there is one that we would like to adapt that we think it fits perfectly with how health centers function and is culturally competent in the way that we want to act towards marginalized populations, including people experiencing homelessness. See if there's an assessment tool out there that really encompasses everything that we want to see in an assessment. Otherwise, we'll have discussions about how we take different pieces from the different assessments and really come up with something that is comprehensive enough for our health centers, but also diverse enough because we know every health center is very different. So we'll spend a lot of our action sessions kind of reviewing those assessments, and then our learning sessions will be talking about them and figuring out which assessment tool we want to use, or if we want to develop our own, and then also how do you get this tool implemented at your local organization? How do you develop a trauma-informed committee with your staff in order to develop the assessment and figure out how you want to implement it, who wants to be conducting the surveys or the assessments, and what you need to review, and have a group come together to assess it, which will be a part of kind of the organizational implementation plan, which takes place in year 2. So we're going to have some conversations about what that organizational plan for implementation looks like, just developing the structure around it. Health centers and our participants will not be required to start developing those trauma-informed committees or conducting the assessments until year 2, which is year 2 is our implementation year, but we'll just start considering how do you develop a successful organizational plan to do that. And then the final component of our year 1 structure will be a one-on-one check-in. So every other month, you will be meeting with me and Julie just via phone call so we can check in, make sure that you guys are feeling comfortable with the workload, with the content, with the assessment plans, make sure that we're answering any questions that we need, supporting in every way we can. Want to make sure that we're trying to live our values of being a trauma-informed organization and make sure we're providing people the chance to be transparent and open and honest with us about the process and where they are. So we'll just do one-on-one check-ins to support people as they need. So in implementing all of this, some of our key dates for year one, you can also find in the application, as Julie mentioned. But I'll just review some of them. The very first section, our kickoff session, will be a 2-hour-long meeting on January 10th. We'll spend that kickoff making sure that we get to know each other, looking at some of the curriculum and the plan for our year one phase of this learning collaborative, seeing if we all agree on that plan and figure out how we're going to implement it. We'll get to know one another and figure out how we all feel about trauma and trauma-informed models, and kind of make sure we're all on that same page about what trauma-informed organizations are. So that'll be our first part of that kickoff meeting on January 10th. So there will be a little prep work to be ready for that meeting. There will be our notifications about participants will go out December 22nd. And then on that December 22nd, when we send out those notifications, we'll include some of the pre-work, which is just some background about the Learning Collaborative and a quick trauma-informed overview. So there will be some pre-work that needs to be done between December 22nd and January 10th. Hopefully folks can read at home by the fire while they're on break in a very relaxing sort of space. And then again, our interactive web sessions will be what those learning sessions are, those 90-minute meetings. Those are booked out the first Wednesday of every month. So we hope folks are able to participate in that the first Wednesday of the month, because that time is already set. So if you are able to participate in those, that'll be when we're doing those 90-minute learning sessions. And then finally, we do have a face-to-face meeting scheduled at our national conference, which will take place this year in Minneapolis on May 17th. We will have the option for people to come to that meeting via conference call. You are not required to be at that face-to-face meeting, but we want to make sure that as a collaborative, we're getting some time together and really building our relationships together. And so we wanted to make space at the national conference to really get to know one another in a face-to-face meeting. So if you are able to attend the conference, to attend that meeting, that would be wonderful. Otherwise, we'll allow people to join by conference call. That'll be at the end when we're wrapping up a little bit, and we'll be analyzing the assessment tool and some of the organizational plans we've looked at and start moving towards finalizing our plan for year two. I want to, again, encourage folks to, at this point, we're going to take a little bit of a break to ask any questions that people have about the project itself, either the 3-year project or the 1-year. We want to pause before we go on to the actual application process itself to just ask questions about the project itself. So if you see at the bottom of your screen in the Q&A pod, you can type in your questions there, and we'll make sure to facilitate it, answering it here.
I can quickly respond to Melissa and Leslie's question about the application process for year one. So yes, the application is currently open, and we will talk about exactly what that will include. But if you want to look at the questions that are on the application, you can go ahead and click in the web links pod below the presentation slide. If you just click on application page, and it should highlight blue, and then you click browse at the bottom, then it will open that up for you. We also received another question about clarification around the one-on-one sessions, whether they'll be scheduled for everyone, regardless, or if they're only scheduled as needed. So we will require the one-on-one sessions, and those will take place every other month. So it'll be 3 one-on-one sessions each year. Okay, and then one more question, and then we'll move on to how to join the Learning Collaborative. Does that sound good, Katherine?
Yeah, we've got one more question that's specifically about the project. There have been other questions that are asked about the application and who's eligible, and we'll make sure to hit those after we kind of review the application. So we have one more question about the project itself we'll answer, but we make sure we'll answer everybody's questions at the end about who's eligible.
Okay. So which question did you want me to respond to now?
Oh, so I think that the question was is there any option to attend the learning sessions if you aren't available during the Wednesday time?
Oh, okay, that's the one that I was looking at. I just wanted to be sure. So to answer that question, that will be the required time for the learning session. So we all will have to meet in person, so that will actually be a requirement to participate in the Learning Collaborative on those Wednesday monthly meetings. All right, so I have just 4 more slides, and maybe what I share on these slides may answer some of your questions, but keep them coming if you have them. So the 4 slides, I will go over the criteria for a Learning Collaborative participant. So what is it that you will need to be able to do to be eligible for the project? And then I'll also cover some of the important expectations that we have for the Learning Collaborative participants, and then I'll wrap up with exactly what you will need to do to apply. But first, thinking about what participants can expect, or the benefits of joining the Learning Collaborative, other than helping council staff with developing these resources, with achieving our larger goals for the project, including planning logic models for a trauma-informed healthcare for the homeless program. Outside of that, participants will get to meet and discuss trauma with other staff from other healthcare for the homeless programs. They'll be sharing experiences in how they're addressing trauma at that organizational level, but also at a community level. And we'll be able to learn about available trauma resources, as well as share information and share, your knowledge about available resources or your experiences with attempting to become more trauma-informed. You'll also receive training, so that didactic piece of learning. And it's a very active and engaged process, the Learning Collaborative. So you'll be able to ask questions, share those challenges, share experiences, but also receive guidance from not only your peers and colleagues, but our invited subject matter experts and our collaborative partners. And, that peer support is such a huge piece. So not only will you be receiving the peer support, but also being able to offer that to other programs, which we see as a need and very valued. Let's see. Okay, and sorry, the last bullet point, achieving our Learning Collaborative learning objectives. So for this year, we have 6 learning objectives, and those are, we want folks to, when they're finished with the experience for the first year, we want them to be able to list how trauma can impact an individual physically, cognitively, behaviorally, emotionally, interpersonally, and spiritually, so really have that solid understanding of the consequences of trauma, but also be able to relate the dynamics between the micro and macro level responses to trauma, so that organizational piece, but also how it ties and overlaps with that more individualized direct care treatment of trauma on that micro level. Third, we want you all to be able to explain the relationship between homelessness and trauma. Fourth, describe various trauma-informed models. So there's not only one, there are many. So be able to talk about the different models and the principles that fall within those different models. Also, I think more importantly, what people are interested in is demonstrating how these principles, these ideas and theories turn into practice and how they appear as these organizational policies and procedures. But not only that, the interactions, so the relational behavior and communication that takes place at your program. And lastly, for the learning objectives, describing challenges and barriers to changing systems and changing organizations, just more generally. And of course, that will include those potential solutions to challenges. So as you're thinking about the capacity and applying to join this project, we want you to be aware of what will be asked of our participants. If accepted into the Learning Collaborative, we ask that your health center representative attends all 6 interactive web sessions, so those scheduled on Wednesdays, and then complete the homework assignments during the action period. And Katherine listed, a couple of examples, so watching a pre-recorded webinar, or it could be collecting feedback from other staff or consumers at your program, or reading some type of research journal article on the topic of change process or trauma. Also, you'll be asked to attend those bi-monthly one-on-one meetings with us. And also, it's not listed on this slide, but it is in our documents in the application. The executive level staff person who would be required to support your participation in the Learning Collaborative, that individual would also be asked to meet with us twice during the year. So during kind of the beginning part of the project, so January, this upcoming January, and then toward the end in April or May. And then we'll be flexible as far as the timing with that, scheduling those meetings and calls with your executive staff person. And then also we would ask that you agree to engage with our values and principles that we've outlined for the Learning Collaborative. And we spent some time being very thoughtful about aligning those with the trauma-informed principles. And so you can click in the files pod on values and principles to see those outlined. And of course, we will accept feedback from our Learning Collaborative participants since they are agreeing to these principles. Maybe there's something that we left off, that we missed out, so we'll be flexible with that once we get our cohort together for the first year. But those will be our foundational principles and values. Next, we will have a group decision-making model that the cohort will agree to. So we'll have examples of or samples of different types of decision-making models, and we will ask during our first session the group to select one, because we know when there's group engagement, interpersonal engagement, there will always be conflict. So we embrace that. That's an important part of change and group work. But we also want to be prepared to respond to any conflict or just any general decision that needs to be made. So the group will have to agree upon that, and then when that time comes, follow the model that is selected. And then lastly, we would ask all the participants to complete all the evaluation surveys. We will have one electronic version evaluation after each meeting. So that would take about, maybe we approximate 5 to 10 minutes to complete those, but that is very important to our work as well. Okay, and then to be accepted into the Learning Collaborative, what will be required of you all? So these are just the minimum to apply. So if you want to make sure that you have all these down before even applying for the project. But to be accepted, there needs to be one staff person, representative from your health center or program, who, we can think about this person as the trauma-informed champion of your program. But that person would be required to participate in those one-on-one, as well as the learning sessions. And we will also, you all have a choice to have two representatives from your program participate. So it's not limited to that one person, but we would want a primary liaison between the Learning Collaborative and your program. But if you would like two individuals participate in it, we also welcome that. But we also would require assigned support of an executive level or C-suite level staff person. And there's no direct financial cost to participate. But the programs that apply should be providing services to people experiencing homelessness. So this year, this application, you do not necessarily have to be a health center. We are hoping to get a variety of different types of programs. Because we are attempting to tailor the assessment tool to health centers, that is more of our target population, but we do welcome all types of programs serving people experiencing homelessness and community health centers. And we also want a variety of different experience level too. So maybe you've never done any work on the organizational level to become trauma informed. We welcome you. Maybe you have several years of experience. We would welcome you to apply. And maybe you're a smaller program embedded within a larger system, or you're a school-based health center. So we want a variety of different types to participate, because all of that feedback is going to be valuable in developing our tools and resources for the larger healthcare for the homeless community across the country. Okay, then the third bullet point is around the ability to share your organizational documents. Not all of them. Some would be, for example, like an organizational chart or a policy around mental health, addressing mental health of your staff. So some of those HR policies. And we're asking that you be able to share those documents, not widely, but just within the Learning Collaborative. So that would be a requirement. We would also require that the liaison, your primary representative, have the ability to get the feedback from your staff. So during the action periods, one of the homework assignments might be, please share this with at least 5 consumers and 1 person on each of your teams, your behavioral health team, your primary care team, something like this, and bring feedback. Share this document and get feedback and share it with the Learning Collaborative. So is that person able to do that type of work? Is your program willing to do that work? Then you would be eligible to participate in the program. Lastly, as far as time commitment, so even though this is a 3-year project, there's only a requirement to commit to 1 year at a time. And so we're in year 1 now, and so the time commitment would end if you were accepted into the program. It would begin December 22nd with the first meeting kickoff being January 10th, and then wrapping up June 2018. And then every year after that, it would be a year-long commitment. And we estimate about 3 to 5 hours per month for your health center. And that would include participating in the learning sessions. Okay, and just very quickly, lastly, how to apply. The process, so the application is available on our website. You can click the link on your slide or in that web links pod below the slides. And with that, so there are the basic questions in the application, in the online application, asking for contact information, but you will also be able to upload the 2 required documents. And those include the application questions and the MOU for us to have that signed support from your executive staff. And also it outlines, that you agree to engage in our values and principles, which it looks like it kind of disappeared from the values and principles document, disappeared from the files pod. But I think we'll get that re-uploaded there in just a moment. And so you would upload those two documents, your responses to the application questions and the memorandum of understanding with the basic questions, your contact information. Lastly, the key dates, very important. We have our application deadline, so it's open right now, but we will close promptly at midnight on December 15th, so that is a Friday. And within a week, so the following week, December 22nd, you will receive a notice either way, whether you were accepted or not. And, we do have a limited amount of space to 10 programs to participate in the first year cohort. So even though the application might be great, I wish we could accept everyone, but we will not be able to. And so once you receive your acceptance letter on December 22nd, you will have up until January 10th to complete the pre-work packet that Katherine had mentioned. So that is to help everyone that's participating in the Learning Collaborative to get on that baseline knowledge level on, Trauma 101, organizational change, so that when we meet for the first time January 10th, we're already on the same page. We're all ready to just jump into an engaged conversation about the topic and get to work. So that's the last that I have of the slides, and I think we're going to open it up to questions about the application process. And I believe Katherine will be moderating for us.
Yes, thank you. And as you mentioned, a number of people had mentioned there's something wrong with the values and principles document. So we apologize for the delay, but it's very affirming for us to know that people are actually downloading it. We're glad to hear that people are engaging with this webinar and excited to learn about its structure. So that's reaffirming for us. Our tech support is trying to re-upload a correct version now. So hopefully by the end of this webinar, we can get it re-uploaded into the files. We'll also make sure to send all of these files out to all of the registrants after the Learning Collaborative or after the webinar closes, so that you should have it directly in your email as well. So I just wanted to mention that first about the principles and values document. And then some of the questions that had been answered, but we want to make sure that we're reaffirming them for people. And again, we're going to wrap up here in the next 15 minutes, so if you have any last-minute questions, please continue to put them in the Q&A box. So one of our questions here is your initial target audience health centers? What about a health system with multiple health centers?
Great. So I think that individual is thinking more like a public health, maybe department model, or a larger community health center with various sites, clinics, or various programs. We welcome all types of programs. That would be a great perspective to have in the Learning Collaborative, because there are several healthcare for the homeless programs that are embedded in these larger systems. So whether you're coming from one of those small programs, so your program within that larger system, you can be represented as that program. You do not have to be representing the entire system. But if you're wanting to participate as the larger system, that larger health system, we would welcome you all to apply as that larger health system. Katherine, did you want to add anything to that?
I guess the only thing I would add, I think, in terms of eligibility, we want to have a broad base of organizations. As Julie mentioned, we want to get as many diverse perspectives as we can I think we are prioritizing health centers, so health clinics and health centers who serve people experiencing homelessness. They don't have to solely serve people experiencing homelessness, but at least have a part of their population that experiences homelessness, just because we are looking for an assessment that really takes into account how we're assessing trauma-informed organizations, particularly for our marginalized populations and for people experiencing homelessness. And they're meant to be used in a health center, so people with that background will be prioritized, but having individuals from organizations including shelters or organizations who work with health centers, there's no real requirement, but there will be a priority given to health centers and people who serve people experiencing homelessness. But however form that takes, we'll consider everyone, and especially trying to fit a diverse group in. There was a similar question about, can a group of health centers be considered one? And again, on this one, I would say it's similar. Yes, we'll accept. We're really just looking for an individual who is, especially in year one, we're looking for an individual who can really engage with developing the assessment tool and developing an organizational plan. So there will be no limits on kind of who is participating year one. Year two might be a different conversation, just in terms of if you have a group of health centers that are working together, figuring out an organizational plan for how you implement trauma-informed assessments and recommendations will be more complicated. It's not going to be prohibitive, but I think year two might be a little more difficult, but that's much further down the line for that question. And then we have a question about how many programs will be accepted in year one. During year one, we will be accepting 10 health centers or 10 representatives from health centers or primary liaisons. So again, you can have as many, up to 2 liaisons as you want, but we'll have 10 health centers and 10 primary liaisons who are working with us in year one. And I think Julie is going to take the next question that we're getting here. If my executive staff wants more time to discuss and talk about this proposal and may not be ready for the December 15th deadline, should we wait until next year to apply?
Yeah, if you're executive level person, and I think this will get to another question that we received, that executive level person can be any C-suite level, so CEO, COO, CMO, or any other executive level person. So if you do not have the support yet at that level, that would not make sense to apply, because that's one of the requirements to get accepted. At the same time, there is more likelihood if you're participating in year one that because it'll be a shorter application in year two for those that have already been engaged in the process, there's more likelihood to be accepted in year two, because we are encouraging programs to stay with us for the entire project. But just because you can't participate in year one doesn't mean that you're going to be excluded in participating in year two. Might be a little bit more competitive for you for the application, but that would be the only downside to that.
Thank you, Julie. And then we've got 2 other questions about going back to kind of eligibility in terms of health center that maybe my answer raised. So I'm going to throw this back out. Does the term health center mean an SQHC, or a federally qualified health center, or a CHC, a community health center level of healthcare services? Or could this include a healthcare system that includes acute care, primary care, specialty care, outpatient services, mental health services, or a continuum of healthcare services?
Okay, so, well, just to clarify, we are accepting applications from programs serving people experiencing homelessness. So all those would fall under programs. So mental health organization, if you're an actual SQHC, if you're a freestanding clinic, community health center, if you're shelter-based. We are focused on the population more than the program type, although, especially in this first year, but although the 3-year project, we are aimed to develop resources for organizations serving people experiencing homelessness, as well as healthcare, health centers and community health centers, so those CHC, FQHC programs that receive general funding, so the E funding, but also because our special population is healthcare for the homeless, those SPHCs that receive the H homeless funding. I hope that answered the question.
All right, yeah, hopefully that answered. And again, we've got about 10 minutes left, so make sure to put your last-minute questions in that Q&A chat box. We've got a few here up on the table. Next question is, can we split the primary liaison role between 2 different people?
Okay, so your program can apply with 2 people, so those people would be the co-leads, but one person will be assigned as the primary liaison. So your program would have to select who that primary liaison would be, and we would require that person to participate in all of the learning sessions. So if you're thinking, oh, we'll have 2 and we'll have one person join the learning session every other month, that is not going to help. That we don't encourage that, and we actually require that primary liaison participate in all of the learning sessions. Now the secondary or the co-lead is kind of a support person, so maybe they can't join every single Wednesday. Then that would be okay. They're really there to support that primary liaison and maybe completing the homework assignment. So in that way, you 2 could split the work and make sure that the primary liaison is prepared for the upcoming learning session. So if you split the homework, you 2 talk about it, and that way making sure that the primary liaison is, well prepared for the learning sessions. But that is what's required of that primary person.
Okay, thank you. And I just wanted to reiterate once again, you do not have to receive health care for the homeless funding in order to be eligible. If your health center, if your health program, if your service site serves people experiencing homelessness in any capacity, whether you are specifically grant funded for that or not, you are eligible. So you do not specifically have to be funded for health care for the homeless grants to be eligible for this. And then another question we have here is, by what criteria will we be evaluating the applications?
Okay, so there are several questions on the application page. So we do not have a scoring rubric, but we're looking to have the most diversified cohort each year. And diversified meaning the different types of programs, the different participants who will be the liaisons, what roles do they have at your organization? And what types of funding do you receive? What types of services do you provide? And so we are really looking to have the most diversified group so that it can lead to very enriched conversation, discussion, different perspectives, ways to think about these principles, these trauma-informed principles, and what they may look like in your unique organization or situation. And then with the common link between all of the programs that are participating being, as Katherine mentioned, programs that are, we keep reiterating, programs that are serving this special population.
I'll just... Oh, yep, sorry, yep. The only thing I would add would maybe be, in terms of, Julie had mentioned kind of diversity of program site, but I think we also want diversity of experiences. I think this is not a learning collaborative that is solely for administrators or solely for clinicians. We would love to have a very diverse group of individuals present, so that is whether that is an administrator, a development person, a behavioral health therapist, a security staff. We want to make sure that everyone feels open and welcome in that space. Having those different perspectives of how trauma-informed organizations impact individuals will be incredibly useful. So having a very diverse group of individuals present. The only common thread I think we want between those individuals is that they're passionate about this topic. I think, as you can probably see, this is an intensive project that people are signing up for as volunteers. We're asking for 3 hours of your time. So we want people who are really going to engage with this process and participate in the discussions, do the work, and be ready to kind of participate in thinking about how we make this productive for everyone. So we want to make sure that we're getting people who are passionate. So as much as you can put that kind of passion and that consideration into your application, I think that would be another criteria that we're definitely looking at.
Thank you, Katherine.
Okay, and then another question here is, can one person be both the liaison and the executive level representative? I am a director, and the only person above me is our executive director. Do I qualify as the executive level?
That's a great question. You would qualify as the executive level and the liaison. I think what would make your application, or anyone else who's in a similar position, what would make your application more competitive is if you had other people on staff that would support. So if the executive director could also sign off on your MOU, on your support letter, I think that would look great for your application. And also if you had a co-lead, if you had someone who wasn't on that administrative level, could be, anyone from your medical assistant, it could be a other medical provider, doctor, could be a front staff person, outreach worker. So having a team of staff, a multidisciplinary team of staff, and having as much support from your program is going to make your application just seem more competitive, I think. But I don't know if Katherine if you had any thoughts on that.
No, I would agree. I think that's a great summation. Okay, so we've got about 2 minutes, so if you've got any final questions, feel free to throw them up in the Q&A box. As we're waiting for that, I just want to do some final reminders. We were able to get a clean version of the principles and values document uploaded into the file section. So if you were looking for that before and you are still interested, that document should be in your files pod now. We will still send it out to everyone just in case people got off before they were able to see that. And again, we want to reiterate that the deadline is December 15th to get the application in. But me and Julie are available to help you think through your application or any additional questions that come up as you're going through the application process. You can reach both of us at the email address on your screen, tio@nhchc.org. That'll send an email to both of us, so you don't have to remember both of our full names. It'll just send it straight to us. If you have any additional questions, you can send an email to that link there. And then again, the final applications and the web links, I hope everyone has kind of seen those. You will be required for the application to submit a form with some of those basic questions that Julie mentioned, an MOU signed by both you and a C-suite executive, and then fill out the application questions as meaningfully as you can. And so we will be excited to hopefully talk to you all again in the future. We've got one last question as we wrap up here. About the 6 learning objectives. That's not in the material. So that is something that we were going to include in the pre-work packet as if once people are accepted so they can see those. But we can definitely create something real quick to send that out to the registrants, people who were here, just in case you are interested in kind of all of the learning objectives. I hope, as you can see, we're very passionate about this project, and we've tried to put a lot of work and effort into setting it up well so we can be as effective with our time and as thoughtful as we can be. So we're glad to share as much as we can with everyone so you can help think through whether you can participate and what that means for your participation. And so thank you everyone so much for joining us on this call, this informational webinar. We hope everyone is thinking about how you can engage, and if your health center can participate, feel free to reach out to us with any follow-up questions. And then as you close out of this webinar, there will be a quick evaluation about your thoughts about how this informational call went, and we would love to get your feedback in that evaluation so that we can learn and grow as individuals and facilitators. So I hope everyone has a great day, and thank you so much.